15. Kidney disease treatment with details. 1. Dialysis. This is a medical treatment that uses a machine to filter waste and excess fluids from the blood when the kidneys are no longer able to do so effectively. Dialysis can be done in a hospital or at a dialysis center, or it can be done at home with the use of a portable machine. 2. Kidney transplant. This is a surgical procedure in which a healthy kidney from a donor is transplanted into a person with kidney disease. The transplanted kidney takes over the functions of the diseased kidneys and helps to improve kidney function. 3. Medications. Various medications may be prescribed to help control kidney disease and its complications. These may include medications to control blood pressure, lower cholesterol, and manage diabetes, if present. 4. Lifestyle changes. Making healthy lifestyle changes, such as eating a healthy diet, maintaining a healthy weight, and getting regular exercise, can help to slow the progression of kidney disease and improve overall health. 5. Angiotensin-converting enzyme inhibitors, ACE inhibitors, and angiotensin receptor blockers, ARBs. These medications help to relax and widen blood vessels, which can lower blood pressure and improve blood flow to the kidneys. 6. Diuretics. These medications help to remove excess fluid from the body by increasing urine production. They can be helpful in managing fluid buildup and swelling that can occur with kidney disease. 7. Calcium and vitamin D supplements. People with kidney disease may be at risk for bone disease due to low levels of calcium and vitamin D. Taking supplements can help to prevent bone loss and maintain bone health. 8. Iron supplements. Anemia, a condition in which the body does not have enough red blood cells, is common in people with kidney disease. Iron supplements may be prescribed to help increase red blood cell production and improve anemia. 9. Erythropoietin, EPO, injections. These injections can help to stimulate the production of red blood cells and improve anemia in people with kidney disease. 10. Albumin infusions. Albumin is a protein that helps to maintain fluid balance in the body. People with kidney disease may have low levels of albumin, and infusions may be used to help improve fluid balance and prevent complications. 11. Immunosuppressive medications. After a kidney transplant, immunosuppressive medications are often needed to prevent the body from rejecting the transplanted kidney. These medications help to suppress the immune system and reduce the risk of rejection. 12. Plasma exchange. This procedure involves removing and replacing plasma, the liquid portion of the blood, in order to remove substances that may be harmful to the kidneys. It may be used to treat certain types of kidney disease or as a treatment for complications of kidney disease. 13. Stem cell transplant. In some cases, a stem cell transplant may be used to treat kidney disease. Stem cells are immature cells that can develop into different types of cells, including kidney cells. Transplanting stem cells into the body may help to improve kidney function. 14. Renal artery angioplasty. This procedure involves the use of a balloon catheter to widen narrowed or blocked blood vessels in the kidneys. It may be used to improve blood flow to the kidneys and help to improve kidney function. 15. Peritoneal dialysis. This is a type of dialysis that uses the lining of the abdomen, the peritoneal cavity, to filter waste and excess fluids from the blood. A special fluid is introduced into the peritoneal cavity, and the waste is removed through a tube. This procedure can be done at home and does not require a machine. Take care and see you in the next video. Subscribe channel and like the video. Thank you.